Welcome back to Kolors podcast. This is Dakshayani Santasurban. We have Dr. Vamshi Krishna, consultant dermatologist at Kolors Healthcare. And today we are going to talk about keloids. So, how are you, sir?
I'm good. How are you?
I'm doing good. So, what is this keloids?
So keloids are abnormal tissue growth that happens or abnormal wound healing which is happening due to the skin trauma or inflammation which happens over there. So these are, you might have observed a lot of people having some irregular growths or irregular scar tissues at the site of wound injury or at the suture areas, right? So those are called as keloids.
So, doctor, what are these scars?
Yeah. So scars are nothing but your damage or overgrowth in the tissue area, right? So when you have acne scars, right, over there the scars are depressed. Whereas in keloids, the scars are bigger and they are elevated. So there's a difference over here. The common point over here we have to make a note is that injury.
Okay.
So in acne scars, injury is the main culprit, and even in keloids, injury is the main culprit. So the way how body heals will lead to the scar formation.
Injuries in sense just falling down and having a cut or.
Yeah, cut, right? So basically what happens is that suppose you get a cut or
Wound.
a wound is developed or some abrasion or a laceration or you get this piercing done, right? So basically there is some form of skin trauma.
Okay.
So when something happens like this, when there's a trauma to the skin, the first thing which sets in is your inflammation part. So I'm telling you the stages of wound healing right now.
Okay.
So inflammation meaning you get that oozing, the blood oozing, the pain, the redness, the swelling. These are all called as inflammatory phase. So once your inflammatory phase is done, there is a fibroblastic activity. So fibroblastic activity is where a lot of fibroblasts start producing your collagen. So obviously you have a wound over here, so you want that wound to get closed. So with what do you close? So the body automatically produces something called as collagen, which helps in wound healing.
Okay.
So, but the thing is that in normal wound healing, the amount of collagen produced, whatever is required will be utilized, and the extra collagen, whatever is produced, will go away on its own. This happens in normal wound healing. Whereas in keloids, there is no checkpoint. So, what happens is that there is overproduction of this collagen. And now, this overproduction of this collagen will get later matured. So that is what we call it as a maturation phase. So when it is maturing, it should actually close that wound area. Now what happened in keloids, there is overproduction of this collagen, and that collagen got hardened
Okay.
or matured, and that is why you see that raised rubbery bumpy type of scar which is developed at the site of skin trauma.
Are these keloids dangerous?
See, keloids are not dangerous, they are just benign. Meaning they don't have any negative factors and all, but it is a lot of worrisome thing, right? Many people feel very bad about it because at the site of keloid you can have pain, you can have itching, and if it occurs in some irregular areas or some places where you have joints, right, where there is a flexion or a movement, something like that, in those areas if you develop keloids, it will cause a lot of discomfort while you're doing that movement.
Okay.
So the more stretching and all these happen, they give you a pain and discomfort.
So, doctor, who's at risk while developing these keloids?
So basically, keloids can happen to anyone, right? So, but there is a predisposed genetic relation. So already a family history or someone in your family who's having this keloids, then you are already predisposed to develop it. Or any skin trauma, whether be it minor or major. It could be your ear piercing or your wound site or your abrasion, laceration, right? So, or improper wound cleaning or the unhygienic wound area, right? So, what happens is that in such cases, they develop keloid because a lot of stretching can also cause keloid
Okay.
at the wound side. If there is stretching at the wound area, that can also lead to a keloid formation.
Can these keloids be prevented?
We cannot actually prevent them, but there are chances that it can reoccur after treating also, if you have a predisposition.
Okay.
So you have to just make sure that there is not too much of overactivity or action at that keloid area, and then as soon as you develop it, you go for the treatment option, and always choose the best treatment of choice so that there is little lower recurrence rate.
Okay. So, as you said, you choose the best treatment. What type of treatment can be done for keloids?
Yeah. So the primary or the first line of treatment of option is your corticosteroid injections, where we inject a steroid injection into the keloid area, so that reduces the inflammation and it softens it and flattens the scar.
Flattens the scar. So,
Yeah.
it's like a surgery per thing?
No, it's not a surgery. It's a intralesional steroid injection, meaning it is injected into the lesion.
Okay.
So that way, what happens is that it breaks down those collagen, which I have told you, that extra collagen which is formed or built over there. It breaks down it.
Okay.
So it dissolves it. That way, your raised lesion will flatten.
Okay.
And next we have something called as cryotherapy also.
Cryotherapy,
Yeah.
I've seen on internet cryotherapy.
Yeah, cryotherapy is nothing but freezing it.
Okay.
We are freezing it so that there is a necrosis or a tissue necrosis over there. So that way also you are actually destroying the collagen.
Okay.
Then we can go for lasers. We can use CO2 laser also, or you can go combination also.
Is that it can put an end for this?
See, that is what I was telling you. It will reduce and it will remove the extra collagen, whatever is formed over there. But there are high recurrences in people who are predisposed
To bounce back.
Yeah, bounce back. But you can still prevent it.
So, doctor, recent times I've been hearing about hypertrophic scars. What is it exactly?
Hypertrophic scars are also scars only. They look similar to your keloids, but the difference is that keloids usually expand and they grow over your extending your injury area.
Okay.
Suppose there's a suture or there is some type of injury, so your keloids will develop in that area and then they tend to expand also. That is why
do
they have
get spreaded over
yeah,
all
they
over?
spread leaving that area also.
Is it something like an allergy?
No, it's not an allergy, but it's due to that overactivity and inflammatory process.
Okay.
They just spread to the sideways also. That is why you see them like a claw-like projections. Claw is how you get those, right? So, keloid is that way. Whereas hypertrophic scar remains in the wound site only. It does not extend much.
Okay.
And the treatment-wise, hypertrophic scars respond very well compared to keloids, because keloids have a high recurrence rate, whereas hypertrophic scars do not have that much recurrence. And there is itching, redness, a discomfort more felt in keloids compared to hypertrophic scars.
Okay.
So hypertrophic scars usually do not have any of these genetic predisposition. So they can happen to any one of us, and once you get it treated, it is usually gone.
So, doctor, keloids are like a clot thing, scars. So, can it be removed by surgeries?
Yes, you can go for surgery also, but before going for the surgery, we can try these options which I have discussed already: intralesional corticosteroid injections, or cryotherapy, or lasers. Right?
Lasers.
If none of these are working, then the option would be your surgical excision. But ideally, surgical excision is at the end.
Okay.
After you have tried and tested all these procedures, still you don't get the desired outcome, then you can go for a surgery where they cut that part and then suture it up.
Again, so
Yeah.
it's a painful process.
Yes, it's a painful process. That is why I would suggest you to first try these treatment options which are available, easily available, and that can actually be better.
So these options which you gave, the treatments, are there also a painful process, or it is just takes 2 days,
There
three
is
days?
slight pain involved in this because we are breaking down the collagen, so we are inserting the needle into that hard rubbery substance. So there is some discomfort.
So there is no prevention for this, doctor?
Yes, you can ideally reduce the fibroblastic activity, as I've told you, during the wound healing process. So as soon as if someone comes up with a wound at that particular area, preventively we can give a few topical creams
Okay.
that reduce the inflammation and the proliferation of your fibroblasts, so that there is less number of collagen synthesis over there. So that way you can try out by reducing the collagen formation, so that your keloid formation will also be reduced.
Thank you so much, doctor. The information which you have given us is a lot more enough about keloids. We'll meet you soon on the next episode with an interesting topic. Thank you. See you guys soon on Colors Podcast. Thank you.
Thank you.